Sorry. No stress from 2 to 3 today. That's what we're going to focus on. I'm going to close this door so the world can leave us alone. Oh, thank you. All right. So if you didn't hear me say, this is Maya Brower. She's our nurse manager down in supportive living. And she has been leading the supportive living residents in a meditation with Maya on a bi-weekly basis, and that has been going really well. And so that is the reason why we felt like this might be something that we should be bringing to the rest of our campus. So I'm going to go over how does anxiety affect our bodies? What can we do about it? And then different types of meditation. And then at the end of that, Maya is going to lead us in meditation. Okay? So there we go. I tell you what, since everyone's got this handout, I'm just going to let y'all kind of go through, and then I get to be more of a part of things, if that's okay. So why is managing stress more difficult as we age? Well, that's a fun one. Basically, your body, due to chronic health conditions, can't handle stress as well as it could when you were younger. Anyone agree with that? It may be as simple as your heart and your lungs don't work as well as they used to. Your body can't compensate for the extra things that you need to be doing due to that. You may have difficulty getting sleep. Anybody in here difficult getting sleep? Yeah, getting to sleep, staying asleep, sleeping long enough. All of these things drag on our bodies as we age and make it more difficult. Some of it's side effects from your medications. There is nothing you can put in your body that does not have a side effect. And unfortunately, some of those side effects interfere with things like sleep, or they interfere with appetite. Different things, so that affects how we are managing our stress as we age. Very difficult life events that occur. Let's face it, life is not getting easier as we age, no matter what anyone says. And so what all these changes can do as we have stress build up in us, they can mimic the same side effects as dementia. They can cause headaches, irritability, trouble concentrating. Okay? So all of that as we age, and honestly, sometimes other people in our lives, maybe the younger people in your lives, don't recognize your stress. That can be difficult, right? Well, Mom, you're not working. You don't have kids. What do you have to be stressed about? You're living at Springmore. They cook your food. Come on. Why should you have anxiety? That in itself can be difficult to manage our anxiety, right? Lack of acknowledgement. So recognizing that. So age is an issue of mind over matter. If you don't mind, it doesn't matter. Anybody believe that? There's a reason why we laugh at it, because it's not true. But Mark Twain did have a good way with words. Sorry, managing all this stuff. I can't do it without my notes, sorry. So what can we do to manage? We can't stop aging. Well, we can, but that's not a good option, okay? We're not going to stop aging. And we can't necessarily stop all the things that cause anxiety, right? So we got to deal with it. We got to manage it. Something's got to happen. So doing relaxation techniques helps, whatever that may be. There are multitudes of them. Meditation is not the only one. It's just the one that we're going to focus on today. Getting involved in your community. We have a great community here that allows you to seek purpose. That helps. Taking care of yourself. And that's such an ambiguous statement. What does that mean? Right? And that's going to be different for everyone. Sometimes it's setting your boundaries and saying, I can't handle that anymore. I could handle that 10 years ago. I can't handle it now. And being okay with that. So it doesn't always mean getting a pedicure, but getting a pedicure is nice. No one's going to complain. Yes, ma'am.
I have a friend who says, I used to do this. I used to do this. I think I'm Mrs. Eusta.
That's right. Used to. That's exactly right. Eating a balanced diet. Once again, easier said than done as we age. You start losing your sense of taste. You start losing senses of smell. And all of this can affect the types of foods we want to put in our bodies, because guess what? The last thing to lose is sweet. We want sweet. And sweet's good. No problem. I'm all about bringing the sweet. We just got to balance it. Okay? Drinking enough fluids. You know, really keeping, drinking fluids and keeping things, keeping yourself hydrated. Unfortunately, I'm going to help Miss Ford real quick. I got it. Come on in, Miss Margie. Boop. Oh, she wants to get up? Okay. No, you're fine. Okay. But drinking the fluids. And that means, unfortunately, taking it like it's medicine. Drink, 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 drink. Okay? Almost every person as we age has some level of kidney disease. Kidneys just don't work as well. And that's okay. You just got to help them out. When you become dehydrated, you hurt your kidneys. You can't function without kidneys. So, making sure we're drinking plenty. And then creating healthy sleep habits, which once again can be difficult as we have anxiety, right? So how do we consciously work on our sleep habits? And that is like basically sleep hygiene is a thing. Paying attention to, am I going to sleep at the same time? Am I keeping a normal routine before bedtime? Trying to stick to something so that your body gets in a rhythm before you go to sleep. And then we're going to, once again with meditation is something that can help decrease your anxiety before trying to enter into bed. So maybe it's just a 5-minute little mantra meditation for yourself that can help you achieve that sleep that you need. So once again, just helping you manage all the things that are coming at you. So aging gracefully means being flexible, being open, allowing change, enjoying change, and loving yourself. Oh, those are some pretty words. But it does mean being flexible. And the used tos, the lady of the used tos, she's got flexibility because she knows she's not doing it anymore. right? I used to do that, but I don't do it anymore, and it's okay. We don't have to be the same person we were last year. We don't have to be the same person we were 6 months ago. We may want to, but guess what? I don't really want to be the person I was when I was 20. Not a chance. So as we age, we do get better. Oops. All right, so getting into meditation. There are lots and lots of benefits that come from meditation. You got physical health, mental health, and cognitive health. And cognitive health is really important, right? Unfortunately, a lot of people confuse cognitive health with memory. They are not the same. Memory is a component of cognitive health, but it is not the same. Cognitive health is, how do I process information that's coming at me? How do I handle making choices? How do I handle just hearing that someone in my life is going through something unfortunate? That's cognitive health. It's not remembering what day of the week it is. It's not remembering who's president. It is, how do I process information, okay? And if I have a lot of anxiety, I can't process anything coming at me because I'm just still stuck in my head, okay? So that's where we have to learn how to meditate and come out of our heads and try to work through what's up here and what's in here so that we can then take what the world has to give us. And it has plenty. So for physical health benefits, we're going to reduce some blood pressure, and we're going to improve our immune system, and we're going to reduce pain. Okay? Allowing yourself to mentally check in with your body, because you cannot disconnect these two things, allows us to have a full understanding of what's going on in our bodies. And creating a sense of peace is where these physical benefits come from. Our mental health, basically we're decreasing our stress hormones. If you're regularly practicing, it allows you to learn how to focus and expand your, increase the attention span, as well as memory, because you're giving yourself an opportunity to breathe. This is your brain going back to school. We're also just teaching the mind to relax and keep quiet. Sometimes quieting our brains is really difficult. There's so much that we're thinking about and we're processing, or we're not processing, and we're feeling. So just giving it an opportunity to be quiet and trying to just think of putting your child into timeout, right? The hope there is that they're going to come back and be somewhat better behaved, right? That's what you're doing. You're going to put your mind in timeout. I'm going to be quiet. Okay, so for cognitive health, this is the thing I think we're probably all the most interested in. At least I am. I have been absolutely amazed in my time here as I do research, because if y'all haven't figured out, I'm a research person. As I start to learn things, I want to learn more. And so as I do my research, I'm finding how anxiety really does impact our cognitive health. and how that affects how people process information coming at them. And unfortunately, in this population, I am not saying that dementia doesn't exist. It absolutely does. However, things can get confusing. Is it really neurological or is it emotional? There's a fine line between those two things. And so trying to thread that needle, this helps create, if you take care of the anxiety component, that improves the cognitive component. It can improve your executive functions like decision making, planning, and impulse control. Okay? Mental resilience, the ability to cope with challenges a bit more effectively. So if you can teach yourself how to do little 5-minute meditations, if you understand you're becoming overstimulated during the course of your day, then you can step away, take that 5 minutes, get yourself back where you need to be, and then step back into the world. Because that's what we've got to give ourselves, is the space to step back out of the world. Okay, so how do we get started? Well, we're going to start today with Maya. But I want you guys to take this out of here, right? This is just the intro. So start with short periods of time. Just 5 to 10 minutes. You know, you're a beginner. Don't think that you need to sit down for 30. 5 to 10 minutes, and be kind to yourself with that. Focusing on your breathing, what's coming into your body and what's going out of your body. That breath. So research tells us anytime when we breathe in through our nose, the oxygen will go deeper into our lungs. We will then we come back out, we're increasing the oxygen within our blood, and the research tells us we can handle pain better when our blood is better oxygenated. So we can handle pain better. The first thing you're ever going to see me do is get right in your face if you're having a panic attack and tell you to lock eyes with me, and we're going to breathe. Because your brain will slow down. Then you've got to acknowledge what's going on in your body and what's going on in your thoughts. If your thought deviates, let's bring it back to breathing, right? Breathing first. Breathing's always first. So if anybody's up on their CPR, we no longer start with chest compressions. We start with breathing, because breathing is first. If you're not breathing, then we have a problem. So then we're going to end with reflection. What did I get out of that? How does my body feel? Do I feel better? Am I ready to increase my amount of time? And then you're going to start, it's just a matter of habit, right? Brushing your teeth is a habit. Getting dressed is a social norm, but a habit. We want to make it a habit. So like I said, it could be when you first get up. It could be before a meal. Many of us take a moment and pray before every meal. Prayer is meditation. And so taking those moments, in our very harried world, I don't think we pray as much as we used to before meals. But that was a way that people have always been managing, is by taking a moment and then entering into a meal. And then, of course, being kind to yourself. Please, please, always be kind to yourself. There is no perfection. Perfection doesn't exist. All right, so why did we make you all sit in a circle? Thank you so much for doing that. I really appreciate it. But being in a circle allows us to create a sense of safety, togetherness, shared support. We want to create good, positive energy, and we want to bring that all together. So if I'm feeling good, positive energy, and I'm next to Miss Lassiter, and she's feeling good, positive energy, well, now 1 and 1 makes 2, right? And it's just exponentially going to create around the circle. We want to feel a deeper connection. That's very helpful. Being in the group just can create a positive, uplifting atmosphere and enhance the entire process for everyone involved. So, types of meditation. There are all sorts of meditation. So the meditation that we're going to do today is the mindfulness, it's a blend of mindfulness and guided. So mindfulness is just being present in the moment, observing thoughts and emotions without judgment, and developing a heightened awareness of one's self and one's surroundings. The guided is involving a script or voice to lead us through a meditative experience with a specific intention or theme. So all of these are different types that you can do, all the different types of meditation. But like I said, we're just going to focus on the mindfulness today. And so I am going to hand this off to our leader, Miss Maya.
Thank you. I'm going to go ahead and turn on our music just to get us started, okay? She can't turn them down, but so low. Okay, so you can hear me well? Okay. No? I'll try to speak louder. It's my first time with the mic. So today we're just going to focus on, like what Miss Charlotte said, just guided meditation, a little bit of mindfulness. So like she said earlier, sometimes we need to take a little bit of a mental timeout. So I call that like a mental pause. I'll speak louder. So I'll try. So we all deal with a little stress, anxiety. I'm actually experiencing some right now. So we're just going to focus on breath work at this moment, okay? So I'm going to ask all of you to sit with your feet flat on the floor, if you can. You can kind of put your palms in your lap. I'm going to ask you to close your eyes. And I'm going to ask you to take a deep breath in through your nose. And then exhale through your mouth. I'm going to ask you to inhale again through your nose. Exhale through your mouth. Take note of your body just sitting in your chair. Kind of feel yourself sinking in to your seat. Think about your train of thought. We all have a train of thought. Are we worried? Are we anxious? Are we thinking about tomorrow? Are we thinking about where we're going to eat for dinner? In this moment, that does not serve you because we are focused on meditation, the here and the now. Continue to focus on your breath. Inhale. And exhale. As you inhale, I want you to think about relaxation. Where do you go? As you exhale, think about those thoughts that don't serve you leaving your body. All the worry, stress, any type of discomfort is leaving your body. Take note of the music. Where do you go to release it all? Continue to inhale and exhale. Let your brain rest. Inhale, exhale. You are safe. You are relaxed. Inhale, exhale. Inhale and exhale. Okay, everybody. Gonna come back to center. Just gave you a quick little meditation just so you can see how your body feels, how you're feeling mentally, physically. Remember that you can always take a pause wherever you are and ask yourself, what doesn't serve me in this moment? What thoughts don't serve me in this moment? And as you inhale, think about how you want to feel. I want to feel at peace, relaxed, stress-free. And as you exhale, everything that you don't want to feel, release it from your body, okay? Okay. Take note of how you're feeling now. I hope you're relaxed. And I thank you.
Thank you. Not quite sure. I think we have still a couple of people so I'm going to be peaceful to this. But to wrap up, stay in the moment as long as you'd like to stay in the moment. If you have an interest in us expanding the meditation program that has been down in supportive living, certainly let me know. I think both Maya and I have an interest in expanding it, but we need to know that there's an interest. Both North and South Village, just one smaller groups probably tend to do a little bit better. But I do have handouts. So I have some handouts, but you're more than welcome to stay in this space, stay in this moment. I hope it has been as anxiety-free as possible. I hope that I feel served by you and your attendance. I thank you for being here. And if there is anything that we can do to help live a more peaceful life in this setting, certainly I think it's worth doing. So I'm just going to leave it there and let everybody exit as you like. Okay? Thank you all for coming.